They also can't agree on if something's a trigger point or not, but that's okay because trigger points probably don't exist.
Okay, so do trigger points exist? Now, I mean, does a tight, tender spot in the muscle that refers pain to other areas exist? I mean, that's basically the definition that we have, that I had in massage therapy school, and that I still follow today, right? It's just a tight, tender spot in the tissue that a lot of times refers pain to other areas. Super common in the traps. When I push here, it's possible that it contributes to headaches, because if I push here or squeeze here, a lot of times I'll feel that shoot up into my head. Or if I push here right under the skull and the occipital muscles, that can refer pain up into my head, right? And that is what we call a trigger point. Now, what is a knot, or what makes up these trigger points, is a completely different story. This, I'm pretty sure there's about zero agreement on in the massage therapy industry. So I think as massage therapists, we really need to stop coming up with these generic answers when we don't really know. I have no issue telling my client, I'm not really sure why it gets super tight and bound up and knotted up and what feels like these knots to me. I'm not sure why it happened. I'm confident enough in my ability as a therapist that I don't need to make up stories to make myself look better, right? I'm okay saying I don't know something. What I do know is that when I apply pressure to this area and I ease into this tissue, it's very, very calming to this. And almost always we can reduce your pain in one session. Reduce, not get rid of. It's going to take a couple of sessions, most likely, depending on how long this has been an issue. But for sure, we have been, time and time again, we're able to get people down 3-4 points in the pain scale in one session. So that's what I think about trigger points.